In the article, Impacting the Image of Nursing, published in the May through July edition of Georgia Nursing, Deborah Stephen talks about the portrayal of nurses and what we can do to change any negative images. I'm Lynn Tennant, registered nurse, and we're going to talk about that today. So in the article, Deborah discusses how sometimes nurses are seen more like handmaids, and that seems to be true. We've seen that a lot on Facebook recently, even so that we've been known to just be playing cards during our shift. And last year it was that we don't even know what a stethoscope is, that that's for the doctors. The public doesn't always have a very good image of nurses. And oftentimes we're just seen kind of more like a doctor's secretary than really anything else. So how does the public image really affect the ANA Code of Ethics, and specifically provision number 5 and 6? So provision 5 states that nurses are obligated to themselves in their personal morals and ethics. A nurse is expected to have individual integrity. Continuation of both personal and professional growth is also part of this commitment. So if we as nurses expect others, such as the general public and especially our colleagues, to see us as competent and knowledgeable in our careers, then we better make sure that we're staying on top of our growth in our respective field. This includes completing our CEUs, staying on top of our advancement, and then completing any secondary education. In the article, Deborah discusses contributing to the community by writing health-related articles, maybe speaking to civic and community groups about what nursing is and does, and then teaching and mentoring nurses on how to validate all they do with documentation and active involvement. Provision 6 states nurses are responsible for contributing to a moral environment, one that demands respectful interactions among colleagues, mutual peer support, and the ability to identify difficult or unethical situations. It's important for all areas of the team to be able to collaboratively work together for the good of the patient. So if nursing is somehow viewed as a cliche, then the team as a whole could fall apart. Thankfully, I don't find this to be happening in like a hospital setting. And in the article, Deborah talks about communication, teaching good communication skills so that the clinical nurses feel empowered to respond to any negative colleagues in a manner which confronts and stops behavior that affects our image. I think that's very important, especially right now when we find like nurse bullying is a huge thing. Not necessarily maybe with the interdisciplinary teams, but maybe so within your specific work environment. That's still a big deal, right? So this article is short and to the point. It's a very good article. It provides good ideas on how to improve the nursing image, as well as advice on how to stand up for ourselves in our work environment. I hope that everybody reads this article and reviews the video and implements one or maybe a few of these tools to help improve the teamwork and ultimately work toward advancement in the nursing image. Have a great day. Bye.